Hey guys, so I'm on my way to my procedure. I don't know which eye they're doing, but yeah, I will be back after it's all over. I'm pretty sure I can't film in the office, especially while it's getting done. So I will let you know how it goes when it's all over. Sorry for the poor video quality. I'm in my room. So the procedure went well, but I do feel like a little bit like crap right now. So I'm about to go lay down and take a nap. And then, oh, my hair's like sticking up right there. And then later on today, or maybe tomorrow morning, I'll finish up this video and explain pretty much the whole process and everything. But right now, the actual procedure was painless, like the laser part. Why is my hair sticking up like that? The laser part, sorry, I'm getting distracted. The laser part was painless, and I still have a mark above my eye that they put. I tried to wipe it off as best as I could to say which eye it was. But the constricting drops they give you a headache, and the laser itself, like after it was all over, kind of added to the headache. So there's just a little bit of pressure and headache going on. And I do have drops that I have to put in my eye 4 times a day of prednisone, and that should help with swelling and stuff like that. So I have to do that for 5 days. And then on the 8th, I have the other eye done. And right now, my eye is still, like, constricted. If you can see, like, the pupil is really small compared to this one. And it is a little bit blurry. Not too bad, though. Like, I can still see out of it. But everything looks, like, a little bit darker. Like, it feels like I've just been laying on my eye while sleeping. And then, I wake up and it's, like, that grogginess. But other than that, I'm okay. And my cold is just kicking my butt today. So, yeah, I had to get a cold right before my procedure, right? But everything went well. And I'll be back later once I feel a little bit better, I'm going to take my headache medication. They told me to take something for my headache when I get home. So that's what I'm going to do. I'm going to eat a little something, take my headache medication, and take a little nap. And hopefully I should feel a little better when I wake up. And then I'll explain step by step what they did. It was not a long process at all. It was more of a waiting game than anything. So, yeah, I'll be back. Okay, so I'm back. And as you can tell, my eye is still it's still, what did I say it was? I forget the word for it. Where they make my pupil really tiny so they can see what they're doing. It still hasn't gone back to normal yet. And I got the drops, I want to say, around 11:20. Something like that. So it's been 6 hours. And my eye is still not back to normal. So it's still a little bit blurry. I still have the headache right here. I don't have a full-on headache. It's just my eye and above and around it from whatever they did to constrict it. That's what they did, to constrict my eye. So that's, I don't know. I'm kind of thinking that it's going to feel like this until I wake up in the morning. So, I think after a good night's sleep, I'll feel back to normal. The doctor said everything should be back to normal by the morning. So, and I did get my prednisone drops at the pharmacy. I picked them up a few hours ago, and I put one in my eye already. So I'm due for another drop in like maybe like an hour or so. And then I'm going to put it in the last drop before bed. So I have to do 4 drops a day. It says for a week. My doctor said 5 days, but it says a week on the drops. So I'm just going to keep putting them in, I guess, until my next surgery. And then I'm going to have to use the same ones to do that. They gave me 3 bottles. Excuse me. They gave me 3 bottles of it. So I think it's supposed to last me for my second surgery as well. So we'll see about that. But yeah, I'm back to kind of explain what they did and everything like that. So I went in at 9:55. I was supposed to go in and check in and everything. So I did that. There was a lot of waiting. I was waiting in the room for like, okay, let's see, 9:55 for like an hour. So I was waiting for like an hour or so, and then they took me back. They gave me numbing drops and the constricting drops. So the numbing drops were just to numb everything. The constricting drops are what did that to my eye, making the pupil really tiny. So then I went back to the waiting room and I had to sit. So it was more of waiting to get the drops and waiting for that took a while. Like, so the doctor came back at one point. He took like 7 patients and then went and dealt with a patient on the other side for like the exams and stuff like that. And then he came back and then did the next set of people. So I was in the second group and I was the last person. So he finally brought me back. And then the nurse gave me another drop, another numbing drops, because I guess, I don't know, it probably wore off by the time I got back there. So she did that. And then, sorry, I have a cold, so I'm like a little hoarse and coughing a little bit. So then he had me, like, there was this like machine where he had me rest my head, my chin on like a chin rest, and then put my forehead on a forehead rest, and then I had to sit there. And then he had this lens thing that he was, because I was like, do I have to keep my eye open the whole time? And he was like, yes. And I was like, oh my gosh, I know I'm going to blink and then something's going to mess up. And he was like, don't worry, there's this lens thing that goes on your eye, and it will keep you from blinking. So it was this like circular thing that he stuck right here, and it kept my eye open. It's like, he's like, it's basically like a contact on your eye. I didn't feel it at all, probably because of the numbing drops. So I'm sitting there with my eye wide open. And as we're sitting there, he's like, okay, now you're going to hear a snap. And it's going to be loud, like in your ear, but don't jump. And I'm like, oh my goodness. And then the nurse is like, you make people so nervous saying that. So he did that. There was a flash, and it went snap. Like, I'm trying to think of what it sounded like. Like, what comes to mind is like, I want to say like, okay, if you've ever seen like tattoo removal and you hear that snap, 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 snap noise as they're like putting the laser on the tattoo, that's pretty much exactly what it sounded like, except there was only one snap and it was loud. I did jump a little bit, but not enough to make any difference. He was like, you did perfectly. And that was it. That was it. Then I went back to the nurse station where she took my blood pressure. Oh, she took my blood pressure before the procedure and then after the procedure. And then another nurse came and put like 4 rounds of drops in my eye, I guess to flush it out. And then sent me on my way and to pick up drops for my eyes. And that's basically it. So yeah, really quick. The only thing that took long was waiting in the waiting room. The whole procedure Took like a minute. So it was not bad at all. On the 8th, I go for my second one, and then I'm all done. So like I was mistaken. I didn't think there was a recovery time, but there is. The recovery time is about a week. But I shouldn't have any discomfort or any of that. And they said, if you are feeling a little bit of discomfort, just take your normal, you know, pain medicine, like Tylenol, Advil, that kind of thing. So that's basically it. And the recovery is just putting drops in my eyes, just to keep the swelling down and stuff like that, so that there's no other issues. And the drops are a steroid, they're prednisone. But yeah, that's basically it. And then after that, I'm guessing like a week later, they'll have me come in to get my glasses and stuff, because I still need to get that done. I don't know how long they're going to wait. I guess I'll have to wait and see to schedule the appointment the next time I'm in. But yeah, that was everything, and it went really well. And the only thing I'm having issues with is just a headache, which I can deal with. And he said I should be feeling fine by the morning. So yeah, that was everything for today. If you like this video, please give it a thumbs up, leave a comment, and if you haven't already, please subscribe. Thank you for watching. Have an awesome day. Bye.